Now, the first mistake that OTs make is they're not being client-centered in their treatment approach. When I think about being client-centered, I generally just think about how do you help people feel like they belong and that their life is meaningful. And a simple way to do this is just to kind of get on their level and try to understand like who they are and just kind of getting to know them. There's actually like some goals. They're called patient-centered goals, and there's a ton of them that you can actually look up, and they're approved by Medicare, and they're totally they're not objective goals. They're more just very specific goals asking about the patient's life and what could be changed to kind of improve their life. You can actually do this to establish like rapport with the patient, and to kind of help the patient feel like you're more interested in them rather than just going through your list of questions for an evaluation. And the problem with not being client-centered is you're just not going to have as an effective treatment. And just like this muddy trail ahead of me, you are going to get stuck. You're going to kind of tread across. You may cross the trail, but it's not going to be as enjoyable and meaningful to your patient. So what I'm going to do next is I'm actually going to go through this side route here and we'll see how it goes. Introducing yourself. So I see just a lot of OTs don't introduce themselves. They may say like their name and introduce occupational therapy, but they don't really explain what occupational therapy is, and pretty much every person on the planet doesn't know what occupational therapy is. So it's really important to just explain that, talk about OT, explain what you're going to be doing with the patient, because if you can do that and kind of give a patient an idea of what they're doing for the day, they're not going to be so fearful, and your treatment's just going to be more client-centered in general, because you're going to kind of help them know everything that's going to happen before it happens. And when you can do that, you're going to help the client build trust. And when you can build trust, this is how you help the client really push themselves and motivate themselves without you having to try as hard. Now, another mistake I see OTs make in their treatments is they don't make the treatment meaningful. And you know this, like you've been there, a lot of treatments where we're just doing Therex, we're working on an activity but not doing something that's actually functional. So try to just incorporate more functional activities. Make sure your client, I usually check with my client before I do anything. I ask them, hey, do you need to use the bathroom? Did you want to brush your teeth today? Do you want to walk? What would you like to do? Asking the patient like what they want to do is actually going to build trust in them and help them just want to participate more. And a lot of times they don't want to do anything. A simple question to kind of understand their needs can make a huge difference. And sometimes the patient may not want to do anything at all. And as OTs, we need to sometimes be okay with that. I know a lot of times in rehabs, we're pushed to kind of get through the day and see as many patients as we can. And I know, I've been there, I know there's a lot of times where I will push a patient just to kind of, to get to the next patient. But a lot of times lately, I've just been pushing that patient to the end of the day and letting them know, okay, I'm going to come back later. You have to work with me later. Please work with me later is what I'll usually say, because I need to get through this day and I need to see you because it's so important that we continue your care. So those are just some ideas. Make your treatments meaningful. Do whatever you can to find out what will help the patient and what is meaningful for the patient so they can be able to return home. I had a patient not too long ago that she just didn't want to do anything because she just kind of felt like none of the hospital staff like cared about her, and she just kind of felt like people were shaming her all the time. And so what I did for part of my treatment session was just like listening and spending time with the patient, and just listening to the patient actually helped motivate the patient to start doing things. Because I listened, they were willing to get out of bed and work on transfers, which they hadn't done with anybody else. So sometimes just being there for the patient and being their friend and listening and understanding what they're going through can make a huge difference in your session. And the last thing that OTs do wrong is they just spend too much time in their session with the patients. Now, For some treatments, you need to spend more time, but I feel like a lot of your treatments, you can kind of get through them quickly, especially your evaluations. Your evaluations are not time-based anymore, so you should be getting in, doing your evaluation as quick as possible, doing whatever ADLs that will help the patient, and then get in and out as quick as possible. Now for treatments, you do need to spend time with the patient, but make that time matter. I guess what I'm saying is spend less time on non-functional things like getting things set up. For example, have the CNA use the Hoyer lift to lift the patient up into a chair so you can start working with the patient on those things that are most important while they're up in a chair. Don't spend all your time doing these activities that aren't functional, like using a Hoyer lift, so spend your time in a more meaningful way. All right guys, so that's it for this video. I hope you enjoyed it. Please like, subscribe, and I will see you in the next one, and I hope you have a great day.